Meantime, the Medical Board of California changed the location of its quarterly board meeting, holding it for the first time in Bakersfield. It's an opportunity to hear from the community directly while also addressing the issue of the Central Valley's maternal mortality rate and medical negligence in general. 23 ABC's Ruby Rivera spoke with families and advocates about what changes they feel are needed to improve medical care.
While the families at Thursday's meeting agree that conversations are key to seeing true change, they want to see the change happen at a legal level.
You submit a complaint, it mysteriously gets reviewed and investigated, and nothing ever happens. You may or may not get a closure letter, and that's the end of it. There is no dialogue, and so I think this is an important first step.
Alka Ari is one of the many people who tragically lost a family member due to medical negligence. She says her sister was denied proper medical attention at not one, but two hospitals.
She went into the hospital with a stomachache, which turned out to be an intestinal infection, but that wasn't caught.
Ari says when she connected with other families who have gone through the same, she was shocked to hear how common the issue is. Through the work of Consumer Watchdog, Ari and other families have worked for the creation of Senate Bill 815. Patient advocate for Consumer Watchdog Michele Monserratt-Ramos says SB 815 will require final interviews before a complaint is dismissed, those affected to submit a patient impact statement, and not having just doctors review the actions of their peers.
I want them to get to the point where they see the public, they see the families as stakeholders too, because we're as much stakeholders as everyone else, because we're the ones that are losing our families.
Monserratt-Ramos says SB 815 is currently in the legislature, set to be voted on next week in the Assembly Appropriations Committee, where if passed, it will be sent to the Assembly for a full vote. Ari says she feels oftentimes doctors forget the impacts they have when treating patients, and says this bill will not only improve the quality of service for patients everywhere, but will also work to eliminate the stigma of treating patients the same.
And I think that a lot of doctors make the mistake to just treat patients like numbers. And so I think it is important to have that conversation.
Friday's meeting will focus solely on maternal mortality issues in the Central Valley starting at 9 a.m. at the Doubletree Hotel. In Bakersfield, Ruby Rivera, 23 ABC News, connecting you.